Welcome to the Real GI Doc Show. I'm your host, Dr. Fred Gandolfo, and I'm a board-certified gastroenterologist with a medical practice in New York. What do psychiatric patients, gastroenterologists, Queen Elizabeth I, and prisoners all have in common? Well, if you guessed Bezoars, that would be strangely specific, but also correct. On today's show, I will talk about two odd and somewhat uncommon conditions that gastroenterologists sometimes have to face. Pica, which is eating non-food substances, and Bezoars, which are masses of non-digestible material that become stuck in the GI tract. I will review a case of a patient with Pica, we'll talk a little bit about Bezoars, and then we'll discuss the treatment of these rare situations. I will review the difference between TV medicine and real medicine. Plus, we'll pose some interesting questions about the blurred lines between psychiatric conditions and medical conditions. This episode is supposed to be a fun one, so sit back and enjoy as we discuss these unusual medical curiosities. So how did I get on the topic of Bezoars and Pica? It's not the most common thing, although I've seen more than I'd like to. Basically, this started after I was flipping around on the TV with my kids, and we found a show called My Strange Addiction, which I think was on Amazon. I can't remember where it was, but they really wanted to watch it, and we ended up watching an episode about a young lady that was, quote, addicted to eating couch cushions. And that sounded a little strange to me for sure. So we tuned in, and my kids were quite entertained. I was slightly less entertained, but basically, I thought this was like a new show because I'm living under a rock, apparently. But apparently, the show came out in 2011, and these are just like on streaming services now, and apparently it's on TLC too. But the show, this was season 1, dates back to January of 2011. It follows this lady named Adele, who's 30 years old and lives in Florida, and she confesses that she's, quote, addicted to eating couch cushions. And they follow her journey through some gastroenterology procedures and some psychiatric help, and it was somewhat interesting to follow along with, although I'm not sure I want to watch any more episodes. On a side note, the episode has two people that it follows. Basically, it follows another person, and that episode was paired with someone who is a, quote, furry, who dresses up in furry costumes and parades around town, which back in 2011 might have been crazy, but apparently now in 2024, that's a thing. So maybe not a strange addiction after all. But couch cushion eating is definitely still on the list of strange things. So this young lady, basically, they go back and talk about her life, that she started doing this as a child, and it was only brought to her mother's attention when she was 16 years old. But she states that she actually started eating couch cushions when she was 10 years old, or around that time. So the show goes on to say that she's eaten a cumulative weight of 200 pounds of couch cushion material, which is like the foam inside of your cushion of your couch, over her lifetime, which is equivalent to her devouring like 7 couches and 2 chairs, which that's a lot of couches. I typically get full after eating just a love seat, but she ate 7 couches over her lifetime, which is impressive. And now she's 30 years old, and she's on this show, and she's talking about this habit that's really become a problem in her life. And she seeks some professional help about how to stop it, mainly because she started developing abdominal pain, and she went and saw a gastroenterologist. So whenever I see a gastroenterologist on regular TV, even though the show was made 13 years ago, it piques my interest. So she saw a gastroenterologist in Florida somewhere, and on the brief clips that they showed on the show, which I understand are edited, and God knows what they actually talked about and what order they showed it in, because TV can really make things look different than they actually are in reality. But he states that the biggest risk of her couch cushion eating problem is something called a Bezoar. That's Bezoar. And what a Bezoar is, we will talk about. But basically, it's a conglomerate of a bunch of foreign material that gets kind of stuck inside your GI tract. because it's too large to pass through. So he sees her as a patient, and they go through a little bit of a workup, and they go through her story, which includes an upper endoscopy to look into her stomach and includes some CAT scans. Now, before we talk about this patient any further, even though she's not really my patient, this is still kind of an interesting thing to talk about. Before we talk about that any further, it's useful to review some of these issues. The first one being Pica, P-I-C-A, which really is a psychiatric diagnosis. And what Pica entails is, if you look up the definition of Pica, it is the intentional ingestion of non-nutritive objects, most commonly seen in prison inmates and those diagnosed with intellectual disability or psychiatric illness. So Pica is people who eat all kinds of things that are not really food. The most common things that people eat who have Pica are dirt, clay, starch, paper, hair, chalk, metal, and they include ice in this category, although ice is really not, it's water, so I don't know, it kind of is food, but they're eating it not for nutrition. They're kind of compulsively chewing on ice, which we'll go into. And they go on to mention in this review article about Pica that most people who have this condition have some type of underlying psychiatric illness. Somewhere around 80% of people who eat non-nutritive objects have some type of psychiatric condition. But they also kind of lump people who are, quote, malingering, which includes prisoners who try to get out of prison by swallowing objects because they know it will get them out of jail, people with frank psychosis, people with pure Pica, which is often related to intellectual disabilities, OCD, autism, and other problems, including personality disorders. So that is like 80% of people who have Pica. And the other people who suffer from this problem are often deficient in some type of nutrient, and their body is telling them, this is strange, right? Their body is telling them that there's iron and things in the soil, and so you should eat the soil. That's kind of interesting how that works. But again, that's more rare. Typically, people with Pica are doing it because of psychiatric illness. So in this young lady, they go on in the show and talk about that at age 10, her parents were separated, and she started eating couch cushions at that time, and this provided her some type of comfort. In terms of people that I've seen with Pica, when I was a resident and a fellow at NYU, we had the Bellevue Hospital prison ward that was part of our territory that we covered as medical doctors. And if you're not familiar with the city, there is, Bellevue Hospital is a famous place. One of the floors there is a locked prison ward, meaning once you're on that floor, you are actually not in Bellevue anymore, but you're in the New York City or whatever it is prison system, and you are locked in there as a doctor with the inmates, and you're seeing inmates as patients. And those inmates can get there if they have serious enough issues that require them to be transported out of prison. Typically, they would go to another hospital, and if their level of acuity was high enough, they would end up at Bellevue in this locked ward. And as a side note, no one really liked going up there, not because the prisoners were exceptionally scary, because most of them were sick with something, but because you got locked into the prison ward, and a lot of times you'd have to get somewhere in a hurry, and you just couldn't. You couldn't get out of the prison ward fast enough. You had to go through all the gates. There were multiple different gates you'd have to get through, and it was not easy to just roll out of there and go on with the rest of your day. So if you had to go see a prisoner for 8 minutes up in the prison ward, that could take an hour of your day sometimes. And as a resident, that was brutal. So nobody really loved going up there. And we loved it less when we had to go up there and see people who intentionally were swallowing objects to get out of prison for the weekend. What would happen is prisoners who were in prison for a long period of time basically would swallow stuff like paper clips, pens, forks, knives, anything they can kind of get their hands on in everyday life in prison. They would swallow these things on like a Friday. And so they know that they would get transported to Bellevue on a Friday. Nothing kind of gets done over the weekend unless it's a real life-threatening emergency. So they would sit around all weekend and be able to hang out and look at the windows in Bellevue and get a change of scenery. And then we'd have to do their endoscopies typically on a Monday. Although if they swallow something dangerous, we'd have to come in and do it on the weekend. So nobody was happy with that situation except for the prisoner who just got a nice vacation out of prison. And this made me understand that, one, I never want to go to prison because it seems like you would do anything to get out of it. I'm sure these people were not swallowing things on their outside life, and now they're swallowing stuff in prison for, however long their sentence is. So one, it keeps me away from prison. I kind of want to avoid prison for that reason and many other reasons. But two, it gave me a lot of experience, and I guess the whole gastroenterology service over at NYU, a lot of experience doing foreign body retrievals endoscopically, where lots of other training programs probably see, a couple of these things a year or less, and then that has to kind of circulate around multiple different fellows. I would say that each fellow at Bellevue Hospital or at a similar place that's associated with a big prison has a ton of foreign body experience. I've probably done in fellowship, I've probably done 20 or 30 foreign body cases myself, and there's multiple different fellows. So all kinds of stuff, razor blades, forks, knives, toothbrushes, spoons, paper clips, tacks, batteries, and other random things that I can't remember what they were that I've removed from people's stomachs. So it's always fun, and it's good training for that specific task, because sometimes it does come up where someone swallows something accidentally and you need to know how to safely remove it. So good training at Bellevue, but not really the greatest way to get it, which is scoping prisoners who did it on purpose to get out of prison. That being said, that's one of the reasons why people perform this pica type behavior. They eat stuff that's not really nutritive for secondary gain. That's called malingering. But people who are iron deficient anemic also do it. And typically the clue there is that they chew on ice, or they want to eat, or they do eat soil or clay or something in the ground. That's not a normal thing unless you're a farm animal. So if you see a human being eating dirt or clay, either they have psychiatric illness, or they are, or they should be checked for iron deficiency, and they're probably pretty anemic. Now, the chewing on ice thing is interesting because that actually does come up in regular clinical practice in the office. Oftentimes people, usually it's people's spouses, will say, hey, my wife has been chewing on ice like nonstop. Someone will come in for weakness, or they'll come in for some other issue, trouble swallowing or bleeding or whatever it is, and they'll say something like they've been chewing on ice nonstop. And several times I've found that people are iron deficient anemic. So that's a pica-like behavior. And who knows what happens in the brain that tells you to do that, but it's very interesting. So the concern with this patient from the show, back to Adele, the 30-year-old who's been eating couch cushions, was that she was performing this pica behavior, and that she was going to have some type of problem from all this stuff she was eating that was these cushions, they're not really styrofoam, but some type of polymer cushions that she's swallowing, what it's doing to her body on the inside. So the stomach will maybe break this stuff down into a goop, or maybe it won't, and it goes through your digestive tract and probably does not really get absorbed because it's some type of foreign substance, and it can potentially form a concretion of this couch cushion material in your gastrointestinal tract and cause some type of blockage. And that situation is also has a name, and it's also something that I've seen before, rarely, but it does come up sometimes, and that is called a Bezoar. That is Bezoar. And what a Bezoar is, it is a concretion or a mass of foreign material that was ingested. So you see this with animals. Farm animals and other animals have these Bezoars in their stomach from eating, grass and other stuff, and you see it in people for several different reasons as well. Typically, you see a Bezoar in a person who's not performing pica-like activity. In a person who does not have psychiatric illness, you see this in people who have problems with their stomach, motility, or their stomach because they had surgery. So someone who's missing part of their stomach, or they had a stomach surgery of some sort, or they have alterations in their upper GI motility, meaning things are not moving through out of their stomach in the way they're supposed to. They're not clearing their stomach out of all the non-digestible things that come with eating plants. Then sometimes something can sit in the stomach and cause a Bezoar, which is when if you eat fruits or veggies with skins on them, and those skins kind of just sit there, they never get cleared out of your stomach, you eat more and more over the months or years, that it can just keep adding to that. It's like when you make a rubber band ball, you just keep putting more and more on top of it. It keeps getting bigger and bigger, and eventually you have this thing in your stomach that's taking up space, and the bigger it gets, the more impossible it is for the stomach to pass the bezoar through, and you can start getting symptoms. So there's three main types of bezoars, and they're classified as phytobezoars, which come from vegetable material, phyto meaning plant. They're trichobezoars, which come from hair, which is one, pretty gross, but two, happens usually in young ladies who eat their hair and who pull their hair compulsively and eat it. That's trichotillomania is the psychiatric term for compulsive hair pulling. And pharmacobezoars, these are composed of medications. So pharmacobezoars we see sometimes when people take time-release medications like nifedipine and sometimes enteric-coated aspirin. But I've seen those before in patients hospitalized who are sick and maybe in the ICU or have very poor motility in their gut. Maybe they're bedbound and have poor motility overall. And sometimes you do an endoscopy and you find a handful of pills stuck together in the stomach. So those are the three types of bezoars: phytobezoars, trichobezoars, and pharmacobezoars. Now, this is a pretty rare situation, but it is kind of interesting. Historically, people used to think that bezoars had some type of mythical properties or medicinal properties to them. And even the word bezoar, I had to look this up. It's a Persian word that means roughly protection from poison. And you find bezoars in the stomachs of goats, deer, cows, sheep, antelope, and other animals. These things are found after the animal dies, and I guess someone cuts open their stomach in the ancient world and finds this ball of stuff and has, for some reason, thinks it's some type of magical thing. And it's used for it used to be used for medicine. People would grind up bezoars from cow stomachs and use them for all kinds of medicinal purposes. They were also used in jewelry. Apparently, in animals, some of these bezoars would become kind of like calcified and start to look almost like an egg of some sort. And Queen Elizabeth I apparently had a bezoar that was set inside of a silver ring that she wore proudly from some type of animal. That sounds pretty gross. But then again, we wear pearls and things which come from the inside of oysters, right? So who knows whatever's in fashion, I guess, depends on the times. But back in the day, bezoars used to be the thing to have. So back to this patient from the show. So Adele saw a gastroenterologist for a consultation, and the 2-second quote that they said was, or that the gastroenterologist said, was the biggest risk to her health was something called a bezoar, and the next step was to do an endoscopy. So the gastroenterologist said, quote, "We're going to look down into her stomach and see if there's any retained cushion." That may be what happened for the TV show, but I would say this is where reality and TV kind of diverge. Now, in the real world, what you would do if you suspected a foreign body in a person's stomach is you would do imaging, most likely, unless it was obvious that they ingested something, like they just told you that they ingested something. You would still do some imaging, maybe an x-ray. But in this case, with a chronic ingestion of something that's probably not going to be very visible on an x-ray because a couch cushion is not very dense like a piece of metal would be, you would do a CAT scan. That would be the first thing to do, because a CAT scan would likely show if there was some type of blockage or some type of retained material in the stomach. And the reason for this is, one, you want to make sure that you're actually going to make any difference with doing an endoscopy. If there's nothing there, then what's the point of looking? But two, you want to make sure that if you do an endoscopy, this person doesn't have a whole stomach full of foreign material. Because when you put someone to sleep for an endoscopy, the first rule is you have to make sure that they have had nothing to eat or drink for at least 8 hours beforehand. That goes for solid food. Now, couch cushions, I'm pretty sure, count as a solid material. So if you thought that you had a whole stomach full of couch cushions or a giant bezoar made of couch cushion material, that is a contraindication to just doing an endoscopy in like an office center. So then the next scene is they show this doctor doing an endoscopy in some type of an outpatient facility. As a side note, he's just wearing a white coat, gloves, and has his mask down pulled over his chin. So I don't know if this is all for the cameras or if that's how people scoped 15 years ago or whenever this show was made 12 years ago. It's not how we scope now. We kind of wear a gown to protect ourselves and to protect the patient. But regardless, that's just the TV silliness of it all. The the guy did his endoscopy. There was nothing to be found. And then after the endoscopy, he suggested to the patient to get a CAT scan to evaluate for some type of problem in the small intestine, like a blockage from the cushions in the bowel, etc. Now, that in the real world would be done in reverse. I don't think any respectable anesthesiologist would love to put a patient to sleep with foreign material in her stomach without protecting the airway. What you do when you have a foreign body ingestion is typically you put the patient under anesthesia with general anesthesia and you intubate the patient so that you protect the airway. So you put a breathing tube in just like you would for normal surgery, and this way the airway is its own closed circuit, and if stuff is in the stomach, that's going to eventually come out through the esophagus. Either the patient will regurgitate it or you'll pull it out with the scope. The airway is protected and you won't drop a piece of couch cushion into the airway, which could be fatal. So most people would do this, most reasonable people would do this kind of a procedure if they were really suspecting a foreign body in the stomach in a hospital setting with general anesthesia, with the patient intubated, and then you can go down and look and see what you find. Because if you find something, you're going to want to do something about it. So the treatment for gastric Bezoars is, there's a few different treatments. So if you find a foreign body like a couch cushion or a big conglomerate of gunk from couch cushions, I'd assume you'd try to remove it endoscopically. If you could, you would use a snare device or some other device, try to break it up, pull it out. It could take hours. It would be a mess. A lot of times you would look down and see something that's too big to remove, like a trichobezoar. Some of these things can be massive. They can take up the entire lumen of the stomach, and there's no way you're going to remove it with a scope, and sometimes those people need surgery. Now, the other types of Bezoars, the ones that come from plants, the phytobezoars or the pharmacobezoars, you can sometimes remove those endoscopically. And I have done that with smaller ones that you find incidentally. You can break them up with a snare. You can remove them with a little net device called a Roth net. It's like a wire snare that you open and close, and it has like a net attached to it, so you can open and close the net and grab things. It's very useful. And even you can try chemically to break these things up. And the agent of choice, which is kind of scary, is Coca-Cola. Or just, soda or whatever. I guess you could use Pepsi too, but most people say Coca-Cola. So you can either have the patient drink a lot of Coca-Cola, or you can actually place a tube in the stomach through the nose and slowly percolate Coca-Cola through their stomach while the acid and the carbonation in the Coke will break down the gunk that's holding this Bezoar together and potentially could dissolve some of these smaller ones. So that's very interesting and a very cheap and low-tech and kind of cool way to deal with one of these Bezoars. And at the same time, it's kind of scary that people drink Coca-Cola all the time just for fun, and potentially it is a pretty nasty substance to ingest into your body since we use it to dissolve things, but that's neither here nor there. But basically, if the Bezoars don't dissolve, you would remove it endoscopically. Sometimes you can add medications to push the stomach along and make things move better. But these are all like case by case, very strange situations. You have to kind of do this kind of thing case by case and see what you're dealing with. What you would do to prevent, if you have a patient who did not intentionally ingest stuff and just happened to look down there and find a Bezoar in their stomach, you would tell them to increase their water intake. They would try to avoid certain foods in the diet that are classic for forming these conglomerations of non-digestible plant fibers. The most common one is persimmons. These are fruits, but other stringy vegetables like celery and other really fibrous stringy vegetables can get stuck. I've seen this before with figs. People who eat fresh figs can have a Bezoar of fig rinds or skins or whatever you call them that obstructs the intestine. And other high fiber foods. So you want to, if people have had previous gastric surgery or have issues with gastric motility and they've had a Bezoar before, they want to avoid some of these high fiber, stringy, indigestible vegetable materials. As a general rule, they want to drink lots of water, they want to chew their food very well, and of course they want to drink a little bit of Coca-Cola here and there to really break down the gunk, which helps to kind of form the Bezoar. Because what happens is these skins and rinds that are partially digested, they get all gunked up with the stomach mucus and other stomach factors that stick it all together and make it like a proteinaceous, mucousy ball of goo that you can't really remove any other way. So that's Bezoars. And what happened with this young patient? Well, after they looked and did not find a Bezoar, the doctor did a CAT scan and said everything was okay. She was still having abdominal pain. The patient was then invited to seek psychiatric help, And she met with a psychologist, and they started to work on the reasons why she's doing this, because at a certain point, it is not really a gastro issue anymore. It's more of a psych issue. This behavior that she's doing to herself eventually will hurt her, but it sounds like they ruled out all the major catastrophes with the CAT scan and the endoscopy, and now it's all about not doing that behavior that got you in that position. Now, the show cuts away at that point, and they do a little follow-up and say that after 2 weeks of psychiatric therapy, she was admitted to the hospital with a small bowel obstruction from, I guess, couch cushions that she ingested. They don't really go into any details, and you don't know what happened to her. So that was the end of the show, and it kind of in my mind, it was entertaining and kind of interesting, but it also brings up the idea of when is a problem a psychiatric problem and when is it a, quote, medical problem, if you want to make a distinction between those things. So as a gastroenterologist, I am not a trained psychiatrist, although I often pretend to be a psychiatrist because lots of GI issues and psych issues overlap and they play into each other. More the psychiatric issues affecting the GI issues than the opposite. But what you see a lot of in the world and also on this TV show is that someone comes in with whatever problem, the doctors address that problem, and then the patient goes home or moves on, and they don't actually get the underlying psychiatric care that they need to stop doing whatever that problem is that got them in the physical problem in the first place. So if this woman was able to stop eating couch cushions, she probably wouldn't be in the predicament of having to get endoscopies and CAT scans and all these other issues. So at the crux of the matter is really that she has a psychiatric illness, and it's not being appropriately treated. It's being treated by just dealing with whatever bodily symptoms that come up that are threatening to life at that exact time. So she can come back 100 times with bowel obstructions, but it's never really going to address the underlying psych issue. So I'm glad that she was seeking out some type of psychiatric help. This show was made, again, over a decade ago, so who knows what happened between now and then. So when I'm watching a show like My Strange Addiction, I'm wondering who classifies these addictions as strange. To the layperson, it's obvious that eating couch cushions is very strange. It's not normal behavior. You don't walk into a restaurant and see people eating couch cushions. It just doesn't make any sense. It's definitely a weird thing. I would say it's weird. But where is the line between something that's weird and strange and something that is considered acceptable, but also potentially very bad for you? Now, I'm bringing this up because as a gastroenterologist and as a physician in general, I see patients all the time who are harming themselves by doing things that they should not be doing. And despite all the evidence that what they're doing is bad for them and repeated hospitalizations or office visits or procedures or complications, they still do that thing. And it's very hard to rationalize that because it doesn't make sense. It doesn't make sense that someone who has cirrhosis and keeps bleeding from their esophagus because of large varices that were caused by cirrhosis keeps drinking alcohol. That doesn't make sense to a rational person. So why is that, quote, addiction any less strange than Adele over here who's eating couch cushions? They're both potentially harming themselves. But to me, the interesting question is, what is socially acceptable? Who defines that? So you can go to a bar and have a drink, but it doesn't necessarily mean that you're going to drink to oblivion and destroy your liver. You can maybe have smoked cigarettes in college and quit and move on with your life and not necessarily be someone who develops lung cancer or COPD. It doesn't seem like there's really any normal amount of couch cushion that someone's supposed to eat or that someone will eat. But it's kind of in the eye of the beholder, right? I've seen people who eat nails who seem to be totally normal people, who've done it repeatedly, who eat roofing nails. And I've pulled roofing nails out of people's stomachs, the same person actually, repeatedly, who seems to otherwise be a normal person who functions in society. So is that any different than the person who I've had to treat their liver disease 17 times because they come in bleeding 17 times to the hospital from drinking, and every time they come in, they're still drinking? Who is, quote, weirder? Does the cirrhotic person who keeps drinking need a show called My Strange Addiction? It's all like, what society says is weird and what isn't weird in my mind. Because to me, they're both not logical, not rational things. Why are some things more accepted than others? It's frowned upon to eat couch cushions, but you can drink every day and no one bats an eye. Also, with psychological help, if someone comes into the hospital one time after they swallowed thumbtacks or paper clips or a toothbrush, most of the time they're going to get that thing pulled out of their stomach and someone is going to address having psychiatry see the patient. It's not normal to just discharge that person home and say, oh, better luck next time. Don't eat any more nails or toothbrushes or whatever it is. Now, if someone comes in and has a heart attack and it turns out that they smoke cigarettes, nobody gets psychiatric care involved at that time. Nobody's calling psychiatry to come see that patient as an inpatient. I think if you were a psychiatrist and you were called to see that patient, you would probably laugh and say, are you kidding me? Because one, it's very common that a lot of people are smoking cigarettes and having heart attacks, but two, it's not really the right venue for inpatient psychiatric help. So it's an interesting double standard, I think. If someone swallows a paperclip, they see an inpatient psychiatrist. If someone who smokes cigarettes after getting a stent in their heart continues to smoke, nobody calls the men and women in white coats to take them away. But I have to ask you this question. Which one of these strange addictions harms more people in this country every year? All right, that's the end of today's episode. I hope you enjoyed listening and found this episode informative. If you'd like to leave me a question or a comment, you can find me on social media under the username RealGIDoc. You can also go to the website, realgidoc.com, and you can leave me an audio question. Thanks for listening. See you next time.
That's it for this episode of The Real GI Doc Show. Make sure to join Dr. Gandolfo next time to explore another interesting topic in gastrointestinal health. And remember, the views and opinions presented in today's episode are for informational and entertainment purposes only. Nothing discussed in this episode should be considered or used as a substitute for medical advice, diagnosis, or treatment. If you're experiencing a health issue, please consult with a doctor or a medical provider in your area. Thanks again for listening to the show.